Hi, I'm Dr. Shifalika Thakur. I've just done my MD in Pediatrics, and I'm making this video because a lot of you, once you've given your PG entrance exams, you'll be confused about what you want to do. And this video is just about whether you are the right candidate for taking pediatrics. That being said, I also would want to tell you that you can do whatever you want. This is just like in a video if you're confused, because I couldn't find a video like this, and I was in a fix when I was supposed to take my entrance exam, and I was really taken aback by the fact that I was so confused. I always thought I knew what I wanted to do, but clearly that's not enough at moments. So I'm just going to address a few questions that I think I should have asked myself at that point of time, and a few questions that I think would benefit you if you address at this moment, rather than taking it forward and going into the PG and then regretting your decision. So number one is, if you want to take pediatrics, you should place yourself in a situation. What if you are in a house that only has children of all possible ages? Will this scenario be something you are comfortable with? If your answer is yes, or if your answer is yes, as long as it's for few hours, then I think that's a first tick that it's okay. Because when I say a room or a house full of children, I mean toddlers who are crying and screaming, elder children who will not be easy to understand, and children who are not able to tell you what they want or what's hurting them, and still they expect you to understand and love them and care for them. So if you're comfortable in a situation where everything's a bit puzzling because you cannot straight away understand what the person wants, and if you are that if you have the emotion of love and care for children, and you can at least tolerate, if not tolerate might be a harsh word, if not love, if you can live with them peacefully for a few hours in such a situation, then I think pediatrics is not going to be very difficult for you. That being said, I come to my second question. The second question is that I would have rather asked myself is, how deeply will I be affected by things I see on a daily basis? Now, if I take pediatrics and I'm very deeply concerned about the well-being of children, so much so, such an empath, that a child being ill is going to be affecting me so much mentally that it's going to hurt my mental health. So if you are able to separate yourself, your practice, from what you feel on a daily basis every single moment of your life, then you should go ahead with pediatrics. Because the problem is, initially when I went for my MD, and I felt so concerned about children and childcare as a topic that I thought this is the place I wanted to be. But when I saw children struggling, dying, ill, could be saved, could not be saved, when I was put in a situation like that, it started affecting my mental health. Like, for the first 10 days I used to come back home and I used to tell my mother, I don't think I can do this on a daily basis. Like, even taking out an LP of a child becomes difficult. But this is not to deter you, because I did complete my MD in pediatrics, and this was probably because I was at the first point of time when I got posted. I posted in the ICU, and all I was seeing was children who were morbidly ill. So, but then you have to address it. You have to make sure that you're the kind of person who can let all of this not get to you. And if you can do that, which I think is necessary for any field that deals with clinical medicine, even somebody who is in cardio has to face people dying in his daily practice. In fact, anything at all, even emergency, that too, that's a lot. So if you are okay with all of that, then I think that's good enough. Third thing, are you ready to do emergency calls and nights all through your life? Now, see, I know once you become a professor and everything, you are relieved sort of on your night duties. Like, maybe you're in the campus but you're not always on call. All that is fine, but you have to realize that a major chunk of your life is not going to be like that. When you're in your SR ship, you'll have full night duties and you'll be accountable for every single thing that's happening. You will be sampling children, you will be intubating them all through your SR ship. And so this is not just a JR1 thing. So if you're okay with a situation where it's core medicine, you'll have emergency duties, you'll have night duties, then I think this is a good field for you, because it keeps you on your toes. You cannot be, resting on duty ever. It's not something that okay 5 minute में देख लेंगे, because children, they change so quickly. The situation just becomes so serious at any moment, and monitoring is a very important part of pediatrics, and if that's not done, I don't think you're doing justice to children. And I think the next question I would ask myself is, what are my future goals? Now, here there are 2 3 things that are very simple. If your goal is, you want to stay attached to a medical college, do a academic SRship, and then you want to become a professor, and most of the government institutes do not allow private practice. So if you're okay with that, if that's what you want to do, then I think pediatrics is a really good field, because there are new things coming up, there are new research coming up. There are a lot of things you can study, you can teach, and pediatrics that way is a very academic plus a clinical branch. There is an equal input of both, so you're not ever going to be, feeling like you have nothing on your hand. You always will, which is actually a good thing, I'd say, because a lot of us, we, after doing so much of academics, we want to stay in that field, at least in, at in some degrees. So that is one thing that you can do in your future. And the second thing is, if you want to, go for a private practice. Now, there's a huge lie that goes around that pediatricians don't earn as well as other doctors. I don't think that's true. I think how well a doctor does depends a lot on the market saturation, on how good a doctor you are, how is your rapport with patients, how quickly you build your trust, and of course publicity, marketing, and everything. So private practice, do not think that it won't pay you enough, because I all through my childhood, I used to see a pediatrician who was outstanding, who did better than so many other doctors. So I don't think that should deter you from anything. And when it comes to getting your own setup, what happens is, once you're done with your PG, it's usually better to join an SRship, so you can get a hold of, things better, concepts better, case management better. It can be in private, it can be government academic. And along with that, you should, slowly try to build your own patient people who, who can actually refer patients to you. So you should start seeing patients in whatever possible ways you can. Don't do it if it's not allowed in your institute, though. And since there is always this thing that you can always start with just an OPD practice or a vaccination practice, and then later you can expand to indoor, and admitting NICU children, and PICUs and general wards. So you have that liberty. Plus, also, I think that being attached to a few gynae institutes is always good, because you'll be on call, and you'll of course get a lot of neonates that you can see there, and you can probably do good for. So yes, there every practice is difficult to set up if you're not, consistent. But saying the same thing in a better word would be, no practice is easy, but there's nothing as the person is not able to practice well because he's a pediatrician or she's a pediatrician. And I think the last thing that I would want you to ask yourself is, how comfortable are you with doing fellowship or DM? Now, pediatrics is good enough in N branch. You don't necessarily have to do a DM. But that being said, the competition is rising so much that I believe that to survive in a very competitive world, you might have to do a DM or a fellowship. So DM neonatology is really rampant. So there are a lot of seats. I wouldn't say a lot, because not everybody gets in. The competition is always high. But and so neonatology is there, and there are a lot of fields where you have DM, but the seats are not a lot. So I think if you do decide that you want to go for a DM or a fellowship immediately, I guess the best time to start studying would be during your MD. And however, if you're clear that you want to practice in, somewhere where you don't think it would be necessary, then I think pediatric is good enough, because everybody will bring their children to a pediatrician, and then most of the super specialists, they're managing the general cases more than the super specializations that they've done in. So there's that. And I guess, once you've answered all these questions for yourself, I think you would be really clear about whether you want to do MD Pediatrics or whether you would want to rethink ki medicine karna. Like, if you're sure that you want to do DM, you don't want to do general practice, then I would suggest that it's good to just go for medicine, because once you do a medicine MD, then you are open to everything. But however, with pediatrics, you will not be able to do everything, and you'll probably not have the same exposure as a person who's done an MD in adult medicine. And of course, the intern syllabus and everything is also different. However, if you want to do a DM in like a pediatric field, so then it's good enough to start studying at least in the final year. And I guess that is all that I wanted to know. My experience at IGMS was very good, because IGMS as an institute, we had a good balance. Like, we were 3 PGs in our batch, and though we had like duties every day, but at least we had a fixed group of patients that we had to see. And everybody was really helpful, and it was an academic institute, and everybody was interested in teaching you, so that's a big thing. But I would also like to tell you that this is not the case everywhere. Some places have so much a load that you might not be able to pick up the book in the first year, which is also fine, because you're here to learn the clinical skills as well. And you might get ample of time in your third year if everybody cooperates well. And so, though I really had a tough time in the first month when I was posted in the ICU seeing children die, I was so concerned about the well-being of children and how I couldn't do enough. It affected me so much that I had decided कि मैं तो give up कर दूँगी. But then very quickly my other co-PGs came, and I realized that this is something everybody goes through. Nobody sees people dying on a daily basis, so, and especially children. And I think all 3 of us, we kind of went through similar things together, and then talking to them, I realized they're just as empathetic with children as I am, and we quickly got over all of that. And not everybody has this struggle, because all the juniors that I had, they were pretty happy with whatever they saw and whatever they learned. And I guess that is all, and I am not gonna be heavily editing this video because I'm really tired. Actually, I just got married, and my PG just got completed, and my mother is not really keeping well. So I'm just gonna post this video as it is, and I hope this helps you in whatever way possible. Thank you so much. Do follow and subscribe, and I will try keeping up with some more videos. Thank you. Bye bye.